That's. Oh, mine's working.
We go see.
Can you hear me now?
Oh, there you go.
Minor miracle.
All right, next item on the agenda is the adoption of the agenda.
Mhm.
So the board members have the agenda in front of them. We get a motion to approve.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda is the approval of the minutes from our April 19th, 2023 regular meeting. Hopefully everybody's had a chance to review the minutes. You wanna-
I'll move to approve.
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Minutes are approved. Next item on the agenda is board president announcements. I have no announcements today. Other than just to appreciate Dr. Serban and his continued work and all the department heads and everything that is being dealt with on a daily basis. So we appreciate you. Next item on the agenda is health officer presentation and report. Dr. Serban, anything you want to point out in this month's report? Or do you just want to?
Well, in general, of course, the department is quite busy as they have been previously. Everybody's doing a very good job. I'm very pleased with all the departments and their production and professionalism. We'll be having some turnover and that causes some angst to me. Unfortunately, losing some talent. But we'll have to figure that out. We'll have to recover from that and go forward. As far as the grant appropriations, we got all of them last night, which I was happy about. Hopefully we'll continue to have a good streak.
Okay, thank you. Board members, any questions or comments on the?
I had a question about the environmental health unit.
Sure.
On page 9, it looks like we're collecting a new stat. It's in the lower quarter of on page 9, total permit applications received and then total permits issued. Is that a new statistic that, new data point that we're collecting? And if so, how is that different than A and B where it says permit applications received and permits issued?
Brett's gonna look that up. I think I've seen that elsewhere in other places. But
Mhm. The new data point.
Which data point are you looking at?
You know what? I'm looking under replacement. And so I was looking at what the third line underneath and the fourth line underneath. And it says year to date for 2023, we did 141, but there were no data points prior to that. So I was just wondering if that was a new data point that we're collecting. And if so, what is it?
Yeah, that is our well drilling program. Those are the permits we received and issued. We've been doing that for our septic permits for the past couple of years, but for reasons, we just had not been doing that for the well ones. And so we thought that for consistency's sake, we were including both of those. The other data points that just have not been calculated yet since we just started. We haven't gone back through our challenging system to get those data points.
Okay. All right, cool. Thanks.
Any other questions?
Yeah, I have one question. Last month you talked about the mobile health unit, the emergency preparedness unit, and some funding from the state to do some improvements. I just wanted to know any updates on that and how the whole process of updating the unit is going.
Yeah, Harry's
All
been on top,
prepared.
Harry's on top of that big time.
I figured he would be.
Hey, so for the mobile unit, we got everything checked out. We got a quote from Prime Time. That's the custom vehicle people that we utilize. They were great about it. They got it in quick, got us a quote, got everything ready to go. All we're waiting for now is for the Healthcare Coalition to receive the funds from IDOH. And as soon as they do, we'll be ready to pull the trigger on that. Yeah, we're good to go.
Do you have a rough number of how much it's going to cost?
Yeah, I think it's gonna be 9,000 and some change.
Oh.
9,600, something like that. I don't remember the exact number off the top of my head, but it was under the 30 something thousand they were offering us. So the rest is going back to the Healthcare Coalition then.
Well, that's great.
Yeah,
That's great. And you're
Yeah.
going to have a nice warm band.
we're very excited about it. Yes.
Good. Thank you.
I had another question, Dr. Serban, regarding the public health infrastructure dollars. I understand that they've given us a timeframe in which for us to have a proposed budget about how we might spend those things. Can you just talk a little bit about what process, what you're doing to prepare for that? How, like, what's that looking like?
Yeah, the submission has to be in by September 1st. And so we want to basically have a lot of information on what we have, solid numbers. We'd like it, obviously, by the end of June, very solid numbers on existing programs, existing capital needs, existing personnel. We'll have to back some monies out. I think it was 630,000 from one of the state immunization grants would go away. So that gets kicked off the top, and there may be some other things like that. But I want to have a very hard accounting to give to the board. Amy Rupi is already having all the department heads come up with their pro formas on all of this stuff. We already had our first meeting on it, and we're going to be having that, talking about it every week, because we really want to get on top of it. I have a feeling many of the counties in the state will not be on top of this process. So if we get everything in, get it submitted, get the okays, because we'll have to go through all the steps for the county government. But if we get all the okays for that, it'll be a significant amount of money. We'll be just shy of the maximum amount. There's a calculation that if the county chips in X dollars, you get the full amount, and we're 0.2% less than the absolute max. So 0.2% of the maximum dollars is about $8,600 that we would not get. But that's pretty small. And then when we have all these hard numbers, I would really like to see if any new programs we could institute, especially if it's something we can come up that can we get going fairly quickly. But we want to know what kind of number we're working with.
2 follow-up questions. You mentioned getting numbers in front of the board. Do you have a time frame yet when you expect that might happen, or is it too soon to ask that question?
Really? So.
That's great. Thank you. The second follow-up that I had is you mentioned you'd wanted to do some new programs. What would those new programs, what might that entail?
Well, we don't have anything specific. I've asked some department heads if they have any wish lists for new or different things, and some people have responded with that, and with time we'll get a bigger wish list. I would ask if any member of the board of health have any wish lists to get those to me as well. And we can get a list and see what's, number one, doable. It's pretty easy. Number two, that we have the money for it. Number three, that we can execute it fairly rapidly. I think there's something like 9 or 10 things people have submitted so far, but I think it's going to get a lot longer as time goes by, and we'll see, because we really will have to work backwards. In other words, X amount of money's left and what can fit in there.
Thank you.
Could, I guess it's a question for Amy. Could you email those dates to us just so that we have them? Okay, thanks.
Any other questions or comments? Suggestions? Thank you, Dr. Serban. Next item on the agenda is new business. First item on our new business is the appointment of Jill to a committee. We'd really like Jill to serve on the finance committee if she's willing. So if we could get a motion to that effect.
I will move.
I'll second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2233 salary ordinance, health crisis COAG. Amy's doing a dual role today, so she's
So this is something we have never done before, as it wasn't required of us to do so. We are needing to bridge the gap. So when a grant ends and before the appropriation has gone through council and then approved by commissioners at their next meeting, we need to have funds available to continue having personnel on staff and continue the programming. So we have discretionary funds available in our crisis COAG grant that we would like to use to be able to bridge the gap. So this covers all of the part-time and full-time grant funded staff within the department that is not on a calendar year. This did go to council yesterday, just to get on their agenda because of the short time frame. We have a lot of grants that expire June 30th. So we need it approved before January 1st hits. So it has gone from the committee to the public full council with a favorable recommendation. However, I do still need Board of Health approval since it is establishing salaries.
You said it approved before January?
In July, excuse me,
July,
sorry,
Yes,
preferably July.
okay. That's what I thought you meant. Any questions? Would anybody care to make a motion to approve?
Motion to approve?
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item is 2334 salary amendment, health, safety, and
And this is the health safety pin grant in order to increase the hourly rate as it did not receive the 5.9% increase that all other Department of Health staff received in the beginning of 2023. So this is increasing that hourly rate.
great. Any questions? Otherwise, I'll entertain a motion.
Motion to approve?
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Item 2335, discussion and vote on the 2024 budget, the County Health Department Fund.
And before you is the draft for the 4 budgets that have to go through the budget cycle. They all have been approved and sent with a favorable recommendation from the Finance Committee of the Board of Health. If you would like, I can go through each budget and note the changes, whether it was an increase or decrease from our current budget cycle.
Sure. I think that would be
Please.
worth the time.
Okay. So we're going to start with County Health, which is our main tax and fee generating budget that does staff most of the Department of Health. For line item 11055, which are the numbers on the left of the spreadsheet, that is our county health officer, and that is increasing the salary to $250,000 for an annual salary. That was heard last night at the council meeting, and there were questions on how that number came about. There were a lot of concerns and discussions had, so they might be reaching out to John Lynn, Michelle, probably Marcel to discuss that.
All right.
Account number 11087, we are needing a billing and coding registrar. We are hoping to move away from VaxCare, which is a third-party company that we use for our vaccines. We want to do all the billing in-house. Right now, they do the billing and they're getting the funds for it. We're only getting $10 a vaccine. So it would be wise of us to have a billings clerk in-house to be able to take all of that on. 11155, which is nurses and other medical. We are reducing the salary. It was originally a nurse's position and now it is a disease investigation specialist. So we're just reducing it to the salary for that position. We also did include an additional disease investigation specialist to help out as they are behind and overwhelmed with what they are doing. 11172 is adding a new environmental health specialist to specifically work on property transfers that have problems with septic systems and or water supply wells. The 2024 salary and benefits for one EHS is going to be covered by the fees that are collected for doing property transfers. The environmental health unit increased the fee to $75 for this year. So it would the fees so far this year are $101,000 and the salary and benefits for one EHS is just over $83,000. So it would cover the cost of the staff. Account 12010, which is data analyst. We wanted to increase that position to be fully funded from the county health fund. Right now, it is partially funded from the CDC grant. We want to move them fully into the county health budget. Account 21030, which is going to be office supplies. We are wanting to pre-imprint some forms instead of having to hand stamp forms, our burial permits. So we want to have that available to us. Account 22406 is a large increase due to us moving away from VaxCare. If that does happen, we will need to be purchasing all of our own vaccine instead of getting it from VaxCare.
That account number was, can you tell me what that account number was again?
22406. Sorry, 06.
Oh, there it is. Sorry, found it. Thank you.
And that's a large increase, yeah,
Mhm.
for moving away from VaxCare. Account 31070, that is funds added to an account that we currently don't have in our budget. If we do billing on our own, we would seek an outside entity to go through the credentialing process for us, as it is a very time-consuming and labor-intensive process. So we would contract with someone to do that. 32550, just reducing the amounts in our discretionary fund, which is the COVID reimbursement funds that we received for administering COVID vaccines and insurance being billed for it. 33938 Vector Fund. We would like to double the amount due to the fact that we had to return the donation to the anonymous donor. We want to have funds available in case of an emergency. Hopefully we don't need it, but we have it. 36015, reduce the amount to cover just what's going to be needed for our Board of Health attorney. And that is all for county health. Are there any questions on those?
So Amy, for the immunization supplies and then also the salary increase,
As well as contractual, if we contract, that's all related to VaxCare.
right, so those funds will, since we're no longer using VaxCare, we'll be able to retain all the funds, so those, that'll be paid for through that savings, right?
Correct. Yes.
You want to approve these individually, or do you want to approve them all at once?
Individually, please.
Okay.
So
I'll make a motion to approve it as presented.
we have a motion. Do we have a second?
Second.
We have a motion and a second. Any further discussion, comments? All right, all those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2336, discussion and vote on the 2024 budget for the countywide lead initiative.
For this fund, we are reducing the amount needed. Originally in 2023, we had every salary listed at the Spanish-speaking salary. We only have 2 Spanish-speaking and 2 non-Spanish speaking. So we have reduced the amount to what is actually needed for 2024. And that is for account 11167. For account 33368, we need to have additional funds to support more public information and education that would be handed out to the citizens of St. Joseph County or to the residents of St. Joseph County. Fund 36500 and 39750, we're just reducing the amount based on what has been used in previous years.
Okay, any questions for Amy? If not, entertain a motion.
Motion to approve?
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2337, discussion and vote on the 2024 budget. Local health services.
Now, these next 2 budgets that we're going to discuss, if we opt in for the Governor's Public Health Commission Senate Bill 4, these will be absorbed into that amount. So we would not have these funds separately going forward. If we opt out of the Governor's Public Health Commission Senate Bill 4, we would still keep these 2 funds. They're calling that the legacy amount. So this would have to be absorbed. So regarding, pretty much there's 3 changes that were made within the budget. Account 21030, 32020, and 33368 were all just reduced based on what has been used in the past years, what's actually going to be needed going forward. So that budget actually has a decrease.
Any questions? If not, I'll entertain a motion.
Motion to approve?
Second.
A motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2338, discussion and vote on the 2024 budget health trust fund.
And this one has no changes, so it's should have started with that one first.
Motion to approve?
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2339, discussion and vote on a new job description, vector specialist seasonal. So before you in the packet is a job description, and I see Brett on his way up. Dr. Serban, is that? Okay, take it away, Brett.
This is just a job description for a, like a vector intern that we can send out. The interns that we've had in years past are not actually county employees, therefore they don't have rights of entry on the property, can't drive county vehicles, et cetera. So this would be a part-time position, not exceeding 30 hours a week. That would be for a college student, somewhere along those lines, for setting traps, picking up traps, that sort of thing.
Motion to approve?
Great.
Second.
Motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. Always like to give Brett a hard time. Next category on the agenda is grant request. Item 2340, apply for a health immunization supplement.
And I had called John Lynn regarding this because the State Department of Health emailed it to us on Tuesday and needed a reply by Thursday. So we've already signed our letter of intent. We can change if need be, but we thought be careful, be safe and just go ahead and sign it and discuss it later. But what this fund is, it's an immunization supplemental grant. It is in the amount of $324,000. And what we're wanting to do is have some of our part-time staff be able to increase their hours. So we would move them to this grant to go from splitting a 37.5-hour work week to be able to work up to 29 hours each person for that. There are some supplies. They would like some AEDs in their mobile unit and within their departments in the clinic. Those are very expensive, so we would use these funds to use that. Once we get the contract for that, I will have the Form D, as we did earlier with the crisis COAG, to list out exactly the salaries, the hourly rates, and what it would be used for. This is just a, what we're thinking that it could be used for.
Motion to approve?
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, say nay. Motion carries. And then this goes to the commissioners. Is that right, Amy?
Yes, yeah, I'll leave that for Jenny when she comes back to do the letter.
Next item on the agenda, 2341, apply for a health crisis COAG grant.
And this is year 3, and I should have mentioned that the previous one is also the 3rd year in a row for this grant. This is year 3, and this grant is a deliverable-based grant where Robin Vita, the Director of Hope, will be working and doing the deliverables as a school liaison between the Department of Health and the schools in the area. It is up to $550,000 if all deliverables are met, and that is what is being used as discretionary money to bridge the gap. So once we do the deliverables, the funds are ours to use as needed.
Any questions? Otherwise, I'll entertain a motion.
Motion to approve?
Second.
We have a motion and a second. Do we have any further discussion? All those in favor say aye.
Aye.
All those opposed say nay. Motion carries. Thank you, Amy.
You're welcome.
Next item on the agenda is old business. We have no old business to discuss. After that is board notifications. We have no notifications of hirings, resignations, retirements, or terminations.
Mr. President,
Oh, yes.
if I may, Dr. Serban, you mentioned in your report that there have been folks who have left. And so I just wanted to hear if terminations, retirements, resignations, but has that changed? So right now it says none for board notifications. And so you
No.
mentioned that
Yeah.
there's some,
None have happened yet, but will be coming. And those folks will be missed greatly.
Sounds like nothing official.
nobody has submitted a letter of resignation.
The letters it hasn't happened yet, so.
So okay, so I know of at least a couple of people who have resigned. So I think that there are 5 resignations. Am I talking out of turn?
I'm not aware of that, but
Okay,
sounds like maybe you are, but
I'm aware of 3 at this time.
okay. I wanted to just bring that, up to date in real time, since when this was put out, of course, Jenny was on vacay and so forth, so that couldn't have been updated. Obviously extremely concerned if it's 3 people who've resigned or 5 people who are going to be resigning. What the plan is to replace and train. A lot of institutional knowledge is going to be leaving us, that skill and talent and so forth. What the plan is for that, I suppose Personnel Committee probably should be instrumental in helping to make sure that we expedite those things. And then next, we're approving grants to receive a lot of money, and with 5 people gone, we know hiring takes a while. I think I'm stating the obvious here for everybody, but I mean, this is the nature of public health. It takes us a while to get folks hired. So I'm just concerned also that we're committing to do all of these things now in these grants and so forth, and we're going to be down at least 3, if not 5 people. So I'm just making us
that's a great.
all on the same page that we're going to be running into an issue of being able to meet our obligations. So,
It'll be very challenging, especially with, like I said, the talent of the folks, some of the folks that are leaving. So, but, we'll have to come up with something. And I spoke with Mr. Lynn about that today as president. And the Personnel Committee, we really need to get on this fairly soon.
On to public comment. If anybody does want to speak, make a public comment, please sign. There's something over there, I think, Amy, yes, the sign up sheet. This is just to set the ground rules for addressing the board. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. And just to set the stage a little bit, last month I felt maybe I was a little too liberal or willing to let people make their point. Several of the comments were personally directed, so today I hope to do a little better job of that. Our first speaker.
Yes, Sam Milligan, 17109 Adams Road, Granger, Indiana. Whether the personnel leaving is 3 or 5, it is my hope and recommendation certainly that the personnel committee review and in detail the exit interviews from these valuable staff so that we have a better, as a community, have a better understanding of how the department can improve itself. Thank you.
Thank you. Cheryl Nix.
Good afternoon. Thanks for allowing me to speak. I'm Cheryl Nix and I live in Clay Township. I'd like to read a few excerpts from an article published in the South Bend Tribune on May 16th of 2023 entitled "Study: Generous Safety Nets Impact Kids' Brains." Generous anti-poverty programs may help narrow gaps in mental health and brain development between children living in low versus high-income households, a new study finds. The analysis published in Nature Communications used data on 10,000 children ages 9 to 11 across 17 states and measured associations between cash assistance programs, Medicaid expansion, and hippocampal volume of children living in high and low income families. The hippocampus is a part of the brain that plays a crucial role in memory, learning, and emotion. Lower volume or smaller size of the hippocampus is linked to cognitive problems. Structural policy interventions may be an effective strategy for reducing these disparities, wrote the authors of the study, which was supported by the National Institute on Drug Abuse at the National Institutes of Health. Past research has shown low income affects children's brain development. Poverty is linked to less predictable environments, stressful life events, such as violence and chronic stressors, all factors that could contribute to the disparities in well-being. Building on those findings, the study shows how social safety net policies and programs can support healthy brain development and well-being in children, experts say. It really points to interventions that can change the course of the youth life, said neurobiologist Gayatri Dowling. We know that kids' brains continue to develop over time, and so if we can identify mechanisms to provide the assistance to relieve the family conflicts and the stressors associated with low income, then we can really help kids change that trajectory. The article goes on, but I just want to say after reading this article, I'm so proud of our health department. Programs like the PACES program, lead abatement program, maternal health initiative, and the community health workers, to name a few, are really impacting, according to the study, the lives of children in our community. And I just could not be prouder. With your permission, Mr. Lynn, I did make some copies of this to give to the members of the Board of Health. So if I'm just going to set them on the counter, if that's okay. Thank you very much.
Thank you. Amy, next.
Good afternoon. Cynthia Heckman Davis, 125 Gemini Lane, Walkerton, Indiana. I attended the County Medical Society meeting last week, and the talk was regarding the increasing numbers of opioid deaths that are being seen in our ERs locally. I believe there were 40 overdose deaths in last month alone. And I want to commend Dr. Serban for speaking up and getting help for areas like Walkerton, where I live, to have more access to opioid overdose treatment. The plain facts are that the pills being distributed on streets are being cut with fentanyl and methamphetamine. And these pills are being manufactured to look just like brand name products. It's scary how much they look alike. And so you can take a pill off the street thinking that you're getting a brand name product and actually getting an unknown quantity of fentanyl or methamphetamine in that. And if you drink with that pill, then it could kill you. It brought to my mind the story of a mother whose son, she said, took one pill at a party and ended up dying from it. So this is going to be, unfortunately, an increasing problem that we'll see in the county, and making efforts to ameliorate that just makes a lot of sense to me. So I want to thank Dr. Serban. Thank you. And of course, the department. And Robin Pita, thank you.
Definitely.
All right, thank you.
Hi, I'm Lisa Tykvanovich. I was just, and the health department's done a great job, you know, a lot of fronts and everything, but there's things that I think need to be addressed and looked at a little bit. I want to draw your attention to Dr. Naomi Wolf's Pfizer document analysis report books that have come out on the COVID-19 vaccine, and how awful, dangerous it is, and how we've been clearly lied to from our government and everything. And you guys are doing grants for immunization clinics and everything like that. And it's one of two books that a judge ruled to be released. And they're Pfizer documents of what, you know, the studies were. They have 3,500 volunteers going over the documents from that, and the amount of deaths, especially with pregnant women. A lot of pregnant women were given the shot and told that they needed that. And now we have given the CV-19 so-called vaccine to pregnant women. The impact to the fetus and the miscarriage rate and stillborn rates are telling. Is this the new abortion pill? One must wonder and ask the questions. The health department needs restructured with true prevention, and you're doing okay in some areas, but you've got to look at some of this information with the vaccines that you're giving to kids and pregnant women. They just okayed the RSV vaccine for pregnant women and everybody. And there was a Mount Sinai medical student that gave this great presentation on the effects and what it would do to pregnant women specifically, and they still okayed it 14-0, that to let it go through. Our government, our CDC, our three-level agencies are lying to us. We're being deceived. I have this book, Cause Unknown, by Edward Dow, that has all the graphs and everything. That's why I would just ask the board, and I would like to even have meetings or anything with you on looking at this, since you're giving these vaccine clinics. One must wonder and ask the question. So we need true informed consent and true health promotion in mind. Equal, yes, justice for all, of all colors, men, women, children, and the unborn, under God, That is true equity. I notice you have so much equity stuff on your, and the one was on the COVID-19, getting it there. Well, there's 62%.
Excuse me, that's 3 minutes.
Okay, thank you.
Thank you very much.
God.
Christopher Huff, 1831 College Street, South Bend. I took note of the regulations that you have on the agenda, which I completely agree with. Statements that are personally directed, abusive, obscene, or inflammatory basically shall not be permitted, and I completely agree with that. Now, just as a reminder, in like junior and high school, the bosses of St. Joseph County are the 300,000 or so of us that live here. They elect the Board of Commissioners. That's tier 2. We also vote for the county council. That's tier 3. The appointed boards and commissions, of which there are any number of here in St. Joseph County, as well as with the city of South Bend, that is tier 4. That is what your function is here. And tier 5, in terms of prioritization, is our paid employees, our staff. And so when I hear and I see later on, and probably a couple months ago, somebody from this board made personally directed, obscene, abusive, and inflammatory language toward the people of my home community, I have a problem with that. And I'm going to tell you something right now, folks. God love you, but I better never, ever hear, see, be directed to any of that
Careful,
again.
please, Mr. Huff,
Okay.
be careful.
I am. I'm coming right up to the edge, but I want to make sure that everybody is clear. Thou shalt pay respect to the people of this community. And that goes for the staff also. This is not a political action committee. You're a board of health. Our paid employees are not members of a political action committee. They're paid employees. So I expect respect both directions. And there's, when the city like this is the 28th most violent in the nation out of 466, we have some problems here. And I don't want any more inflammatory, obscene, abusive remarks from anybody on any of our boards or commissions. I hope it's as clear as the fenestration on the outside of this building. Crystal clear. Thank you.
Amy, that's it? All right, next item on the agenda is a time and place of our next regular meeting, June 21st at 4:30. Back here again on the council chambers. Last item is a adjournment. Can we get a motion to adjourn?
I'll move.
Second.
All those in favor say aye.
Aye.
Opposed say nay. Motion carries. We are adjourned.